Hey friends, it's May 14th and just giving an update for my, I'm in my day 2 of round 3. So I had my second treatment in the third cycle of chemo. So today was the big one. I had Herceptin, perjeta, and Taxotere. And I also had a meeting with Dr. Rob, my oncologist, and I had an echocardiogram to check my heart function, see how it's doing 3 months after the initial Herceptin and perjeta doses, which are the ones that have the HER2 attaching, blockers, HER2 attaching ability to drag it out to the immune system. We could have worded that a lot better. Anyway, they attack the, it's antibody therapy. So I handled it really well. They did the Benadryl, but I will say she started the Benadryl and I got a little sleepy, but I didn't get super sleepy this time. So I didn't really take a big nap today, which was kind of nice because I actually got onto Facebook for the first time in a long time and went back to some of the comments that people had made, and I'm trying to get back to people. So yeah, I got a few more to do before I kind of conked out. So today went really flawless. You know, I was worried that we wouldn't get it all in before 5. I have acupuncture at 5. I usually do acupuncture right after chemo whenever possible, and I've been doing it weekly now for a while. I started that weekly really in January, and I'd been doing it every couple weeks before that, like December, and so it took a while to get weekly. I was doing weekly, in December. Yeah, so I was working with the clinic at the time, so they were mixing herbs and into teas. I was doing decoctions that, essentially were just concentrated driveway water. But, now looking back on it, it wasn't that bad tasting compared to some of the things I've tried now. So, anyway, so acupuncture's been a huge pivotal thing for me. I think it's crucial to tag after chemo. I just feel like it really helps. I mean, I'm certainly doing a lot of other things that are having a lot of benefit to reducing any possible side effects for me. Still got a pretty good head of hair. It's starting to thin a little bit, but it's not bad. I got to get a cut. I mean, I guess I'll try to go real short and just be fun with it. I didn't expect it to keep growing. So, I mean, obviously things are helping. I'm not cold capping. People keep thinking I'm cold capping. I'm not putting anything cold in my head during chemo. I'm just doing the hands and the feet. But I really do believe the acupuncture also helps ward away or maintain the nervous system's health, so ward away peripheral neuropathy and keep fluids moving, keep the chi moving. She did a cool one today that was called Circle the Dragon. So it went around, I'm pretty sure it's called Circle the Dragon. Could have had that wrong, but basically go around the point of trying to focus the chi. So she was trying to direct it around that left lobe of the liver, which is pretty cool. And so I'm doing a lot of things. I do think some of that manual therapy is pretty crucial. So that's a big one. As far as today for other cool things, I guess I'd say mistletoe on Monday was the 22nd time I've done it. 22nd time. So that's awesome and surprising because it goes by fast. I mean, doing it every week now is definitely less than going down every 4 to 5 days, which was a lot. But now just going to Atlanta, about a 4-hour drive down, 4 hours back, 3.5 hours, but with traffic. Give yourself 4, but I mean, now it's just Mondays, and it's not bad. I had a great time. My friend took me down this time, and we had a blast chit-chatting, and she took me again today for a very long day. So, I'm really lucky. I'm surrounded by awesome people that are willing to donate their time and their vehicles and, their life to helping me. So that's really touching. I wanted to mention a few things I'm doing on the side that are helpful. I started an art class at the clinic for mistletoe in Atlanta. I'm working with Jessie. She's an art teacher, and she ordered up some kind of pink alabaster, and it's gorgeous. And so there's just this big old hunk of rock, and she's got all these fun tools to hammer and chisel and kind of oh gosh, I'll remember the name another day, but when you're basically sanding it but with metal tools. I'm sure somebody out there is saying it right now, and I forgot the term. That's fine. I'll learn it again. But so I'm sort of sculpting something. I don't know what yet, but it's going to be good. Just smoothing it out. So that's a really fun activity that people don't always think of doing when you're going through cancer. Try to get back to your creative side. I think one of my mistakes the last decade of my life, if I was to look at it that way, would be that I haven't spent as much time as I used to doing creative ventures. You know, I was always into clay. I was always drawing. I was always doing stuff outside, getting creative, building things. I mean, yeah, I built a really cool spot here, but this was obviously a lot of physical labor. And to me, it was probably happening at a stressful time in my life, and I was using it as a vice to distract myself, and I'm sure that's the unhealthy reason to do it. So I'm proud of all the rock work we did, but you know, it was probably only taxing my body a little too much as well, because I tend to really want to finish a project. So I'm looking to kind of add in, you know, more crafty stuff in my life. I can't wait to get on the pottery wheel more and do that. But right now it's all about chiseling rocks. So feels fun, get to chip on stuff, wear an apron, goggles, good times. A cool thing I was learning from one of the patients there at the clinic that had the ER positive, the hormone positive types of breast cancer, which I do not. I have the HER2 positive. But there is a caveat to mine from the Onconomics Plus that the circulating tumor cells do have ER positive, PR negative, so estrogen receptor positive, I got those, and progesterone receptor negative, don't have those kind of thing. So anyway, I have some of those cells circulating around because there's that sort of heterogeneity, you know, to some tumors, which some people have said is really uncommon, and then I've heard other people say it's pretty common. So I don't know, words out on that one. But I'm going to use that, you know, as just information for the back of my pocket to line, because at the end of this, if I'm having things that are lingering or it's starting to metastasize to other areas that HER2 doesn't typically do, I'm going to assume we're dealing with the ER positive cancers then. So, you know, things I'll make sure I add into my diet are going to be like a lot of flaxseed, indole 3-carbinol, which I'll get back into. I'm not doing that right now. No need with chemo. More quercetin. I'll keep doing quercetin a lot. You know, playing around with ashwagandha here and there, using it cyclically to make sure that I'm, you know, kind of helping to manage the potential elevation of cortisol stress, but not to be taken too long in a row, that ashwagandha. But good stuff. You know, and there's a ton more. That's just kind of a brief overlook. But the ER positive breast cancers they seem more treatable up front, which is what I've mostly read. And most people seem excited when they have them because they have all these tools to hit them with, right? Like we can literally hit them with chemo. We can hit them with radiation, surgery, just like all the other cancers. But here now we can hit them with aromatase inhibitors, which is basically trying to stop your ovaries from working. You can get the surgery, you can get your ovaries out. Or there's like tamoxifen and things like that that are helping to block estrogen and things. But, you know, people don't always discuss the extreme side effects of inhibiting hormones, especially estrogen. I mean, if people don't realize it, it's involved in an insane amount of metabolic reactions, and it's vital for so many functions of your body, things you wouldn't even think of, like your hair growth. Estrogen's a big deal with that. Like some of the men that I've seen on testosterone blockers, you know, to try to stop their prostate cancer from progressing, you know, well, essentially, again, if people have too much testosterone, you can bald more. It's just more testosterone in the body. But when you start blocking testosterone and giving them estrogen, or if trying to function to create more estrogenic effect in the body, they actually get a great head of hair back, which is pretty interesting. I talked to a guy in the clinic who was like, honestly, it's the best head of hair I've had in a really long time. He's like, but unfortunately, I'm moody and I have swings of my mood. You know, I'm sure everybody has some of that, man and woman, but you know, but he's like obviously feeling the ups and downs of messing with the hormone balance. So it's just crazy, you know, when your estrogen specifically is what I've been mostly learning about right now, is when that's blocked, the estrogen has such a play into your joints. So you don't even realize you have some pretty intense joint pains just because of the blockers of estrogen, the body aches, the muscle aches, the headaches, everything. Like when your estrogen is dropping, it's incredible how many things go wrong. So it's a fine line. It's a fine line with all of these. And I'm sure there's more details to tweeze apart as far as what type of estrogen, if it's E1, E2, or E3, and how progesterone's playing into it. So hormones are very complex. I have studied them a long time, and I really wouldn't consider myself at all an expert. But I'm certainly trying to tackle it more to just wrap my head around more the interactions of how all of these things play the dance between every other system in the body. But, that's not been studied much. So that is something that right now in my life is really emerging. They're actually putting some time and effort into figuring out some of the more complex hormone imbalances, specifically in women. It's not that men don't have them, but they seem to be more easily fixed into a box, whereas you start playing around with women's hormones and you really start taking them off the rails pretty quick. So it is a very delicate dance. I wish there was more testing for people early on to figure out where they are with it. But anyway, that was quite a little tangent. Back to why I'm talking about ER-positive cancers is that they tend to come back a lot. So unfortunately, like the woman I was talking to, she was just saying like, after 5 years for her, like she's not out of the woods. She's going to be really looking at a possible, even if you do a double mastectomy, has it popped up somewhere else? Has it taken hold somewhere else in your body? Because estrogen is ever present. And no matter how much you block it, it will find a way. So I know a lot of people who have done all of the blocks, all of the inhibitors, everything they could do, all of the right way to do it, right? Which I'm sure there's many ways. I'm not sure how many of these people used mistletoe and other comboed therapies like high-dose vitamin C and melatonin and low-dose naltrexone and any of that stuff. So I don't know what they're doing, or diet, any of that. But it's kind of crazy to think that it can just it's more often to recur in the people with the hormone, dominant receptor cancers. Wow, what a mouthful. Okay, so I guess the silver lining in that for me is, yeah, well, HER2's pretty aggressive, and maybe 15, 20 years ago, I would have been in a grave pretty quick. But it's more treatable now with Herceptin and perjeta and all these other mixed therapies. And after the 5-year mark, I can breathe a sense of relief because it's not typically one that comes back. So that's really good. That was really good to hear. I needed to hear that because I just got news of an old friend that had it recur in her, and they're not giving her much time. And I also saw another new friend at the clinic that I've been talking to the last couple months who has a triple negative breast cancer. And I'd met her when it wasn't good, and then she was doing really good, and she seems to continue all the things, without knowing her entire personal story, but it's not good now. So it has metastasized, and hers is the triple negative, the really, really bad one, the hard one to treat. There's no receptor. There's nothing to treat. There's no hormone. There's no epidermal receptor like the HER2. There's nothing to grab onto. So this cancer is pretty nasty. And unfortunately for her, it has spread to her hip and it has spread to her lungs. So she's having fibrosis in the lungs, and she has not had radiation or any of that yet. Maybe, hopefully never for her. But yeah, that's a real bummer. I did tell her about the I wave. So when I'm done my circuit with the I wave, which, should be next week, should be the last week I have it. I have Herceptin and Taxotere next week is my last chemo. That's the Taxotere. Really, really hoping for that. I've gotten great changes in the tumor. Hoping for great changes in the liver. So that's really exciting. And then I'm going to return it to her the weekend of Memorial Day. So the clinic is not open on Memorial Day, so I am not going to make mistletoe that week. That'll be the first week off I've had since January, which is going to be kind of crazy, but it's going to be fine. I can skip a week at this point, and it also fall perfectly in line with the week that I meet with my surgeon, which is really good news because when you think about putting fluid into a tumor, it's going to expand, and it always seems bigger and fuller and puffier right after. So Rob, of course, is like got her little device out. They're measuring. She's measuring it. And she's like, oh, it's much different. That's great. And blah, blah, blah. So she's excited. But, to her, she's still like, it's puffy. And I'm like, yeah, well, yesterday I could pinch the skin together. And now I can't because it's full of fluid. So, So she agrees. It probably just needs time to diffuse. But I'm going to hit the castor oil packs right on that tissue and on the lymph nodes and really help move and facilitate some of that fluid so I can get out the debris. Dr. Hancock believes that I've got a lot of debris, some necroses in there. It's just like little pockets of dead cells. So I need to, get in. I need to get moving. I think moving is really important. I do a lot, well, dancing obviously, but I do a lot of Indian clubs. So I've been playing with kind of like 1 pound Indian clubs and just doing a lot of arm movements to keep the lymph moving. I do like my Eldoa warm up, so I'm doing a lot of segmental movements, repetitive kind of movements, and you know, keeping it juicy, I guess, keeping it sliding around. So castor oil will really help if you do the castor oil packs. It really helps diffuse or displace inflammation. It kind of pushes in, especially when you've got heat on top driving it in. And I'll pair it with frankincense because it'll help pull that in too, and that frankincense has a good anti-cancer effect. So yeah, we've got kind of another week of waiting. And then the week after that, we've got the PET scan. I think that's the 23rd. And then we've got the meeting with McAllister, my hopeful surgeon, in Asheville here on the 29th. So wish me luck, guys. I think that kind of covers most of what I wanted to talk to you all today about. But I want to do a little shout out for all those mothers out there. Happy Mother's Day. I hope you had a wonderful weekend. And it should be Mother's Day every day because we wouldn't be here without you. So thanks, moms. And I'm not a mom of a lot of beings this time in my life right now, but I still have one chicken. There she is, a little chicken butt. Fifi? Hi. Hi, Fifi. That's Faye. So she's just the sweetest. She's turned into a dog, and she like walks into our house and all sorts of stuff. So she's living her best life, roaming around our yard. So anyway, I hope you all have a great weekend. Thanks for listening, and take care.